An advanced form of life support has helped save the lives of some of the sickest COVID-19 patients. KOMU Steffi Roche met up with one of those patients who credits the ECMO team at MU Healthcare for helping him get out of the hospital and on his way back to a more normal life. So Steffi, to start in simple terms, what is ECMO?
Well, Emily, ECMO stands for extracorporeal membrane oxygenation. It's essentially a pump with a device that takes blood out of your body and puts it back in. But in that process, it puts oxygen in and takes carbon dioxide out. I talked to one COVID survivor from Warsaw, Missouri, who says if he hadn't been on the ECMO device, he likely would have died.
I wasn't too worried about it. I figured if I got it, I was healthy.
But when Levi Jeans did get COVID last summer, he ended up in the hospital for more than 3 months.
They just took my oxygen level, and I think it was 68. And so they admitted me right away. And I sat I don't remember the exact amount of days, but I sat in the hospital for more than 9 days just doing breathing treatments, and I had lost 30 pounds. Just while I was in there doing the breathing treatments. And then I signed off to let them intubate me. And then I really can't remember much from, little splotches of memory.
A medical team at MU Healthcare has been using ECMO devices since 2017 to treat patients with severe heart and lung conditions. And that team stepped in to treat Levi.
Levi came at the peak of COVID when we had it out here. He unfortunately didn't do well on the ventilator, and we put him on ECMO. He was actually one of our longest runs on ECMO. He was on ECMO for more than 60 days. And that's something that we don't commonly see prior to COVID, where we've put him on ECMO for this long.
ECMO is reserved for the sickest patients who have failed every other medical therapy prior. Researchers at Vanderbilt University say the devices cut the risk of dying from COVID-19 in half.
There were many times where people were afraid that he wouldn't make it.
There was only one time I actually felt like I might actually die, and that's when a buddy was texting me. And other than that, I didn't really feel as though I would die, but it was a really strange experience. I could remember, I can remember feeling the electricity when they restarted my heart.
Levi only has a few memories of his time in the hospital, but one was about his late father, who was life-flighted to MU Healthcare, all while Levi was being treated for COVID.
I think I finally woke up from sedation where I could remember everything on October 12th. He came in there on the 15th. And he passed away on October 17th.
The two took this photo together the day before Levi's father died.
The people from MU brought him up on my floor, which he wasn't even supposed to be on my floor because there was some kind of a heart problem. And they unhooked all my machines and wheeled me in there to his room, so I got to see him before he passed away.
Before Levi was released from the hospital, he had to perform tasks like walking to the sink and washing his own hands.
It wasn't always easy, but he and the people around him had a great attitude. He wanted to work really, really hard to get better, and it was incredibly rewarding to see him come off of ECMO.
But the path to full recovery is not quite over.
The recovery, and I'm still recovering. I'm not 100% by any means. I'm a lot stronger, of course.
Levi says he's still able to ride his motorcycle, but in very hot weather or heavy lifting, he still has trouble breathing. But Levi says his main goal while he was in the hospital was to get out of bed and get home. In the studio, Steffi Roche, KOMU 8 News.